the main difference is that with antibodies, you often have to give them over longer periods of time and continuously. So that's the same for both Blinatumomab and Dinutuximab. They're sort of infused over either 10 days or even 28 days in the case of Blina. So the main challenge is ensuring that we can ambulate these patients because they're well enough. They don't need to necessarily be in the hospital. So you have to teach parents how to use pumps, and you have to have a way of monitoring and making sure it's safe. So that's probably one of the biggest challenges. In terms of the drug itself, they can actually have more sort of allergic type reactions and what we call CRS, or cytokine release syndrome. Whilst we haven't seen a huge amount of it in pediatrics, that certainly is a side effect of any antibody. Dinutuximab in itself has a whole host of not very pleasant side effects for children in itself, just because of the way the drug works. And that can be anything from pain to blood pressure changes, to mobility issues. So I think there's that one's certainly harder to manage, if that makes sense. But essentially, the quality of life the patients get should be better because we're able to send them home for quite a long period of this treatment. I mean, they might come in and out to have bag changes and so on, but they don't get as sick as they do with chemotherapy. You know, they're up and out. They're not stuck in a bed in a bay, and they're not feeling absolutely horrendous after each course.